Hello, I'm Shelley Fuld Nasso, CEO of Cancer Nation. Thank you very much for joining us today for a webinar where we're going to go through the results of our 2025 survivorship survey. I really appreciate you joining us today. We have a lot of great data to share. Thank you to our partners at Edge Research, with whom we have worked on this survey for 7 years. This is our seventh year, and we worked with them even before we worked on the survey. So they are incredible partners, and I'm honored to have Liana Gainsboro from Edge Research here to present the results with some color commentary from me along the way. And we are really grateful again to all of you for joining us today. And Liana, if you want to share the slides, I wanted to recognize our sponsors who made this possible. Pfizer is our presenting sponsor, and we have a host of other sponsors who help make this possible. And I also want to thank the Cancer Nation team for all of your hard work to get this survey out there to our connected advocates and to help us with the analysis and rollout. We are really excited to share with you what we've learned this year. Next slide. And I'm just going to go through what we were hoping to achieve with our survey this year and then turn it over to Liana to go through the results. Every year we use this survey as a way to really try to understand the cancer patient and survivor journey and to understand the issues that they're facing, their satisfaction with their care, where there are gaps in care, how they understand different policy issues that we are working on. And all of it is really to help us better understand how we can support our mission to advocate for quality cancer care for all. So this year we added a few areas of inquiry into our survey. We asked about chronic conditions and their impact on cancer treatment. We often ask questions about post-treatment care, and we added some questions about survivors' confidence in their knowledge of how to manage their care following treatment, and we did a deeper dive on survivorship care plans. We asked some questions about the Medicare prescription payment plan, which is a program that allows people to spread the cost of their prescription drug costs over the year instead of paying it all out at once. We also asked about their comfort level with the implementation of AI in cancer care. And then we always see big challenges that survivors face in emotional and mental health. And we asked some additional questions about that this year. So now I'll turn it over to Liana to go through the results. And please feel free to ask questions in the chat, and we will get to questions at the end. And also, just before she starts, I want to let you know that the webinar will be available for everyone to view afterward, as well as the full report you'll be able to download and the executive summary. Thank you, and turning it over to you, Liana.
Thank you, Shelley. And hello, everyone. Welcome. Just a quick note on methodology before we get started, before we dive in. We surveyed over 2,000 cancer patients and survivors at the end of the summer and the fall of this year. Most of the data that you will see in this report is from our nationally representative survey of cancer patients and survivors, ages 18 and older. This survey included the responses of over 1,300 patients who are a mix of those currently in treatment today, as well as those who have completed their treatment. And we conduct a parallel survey every year as well of what we call the Cancer Nation Connected Audience. Those are people who have chosen to engage with the organization in some capacities. They have about 700 responses from that audience. As we go through the report, looking at that box there on the right, any significant differences between either these audiences or any different subgroups that we highlight, those are highlighted in blue numbers and red numbers. So if a number is in blue, that means it's statistically significantly higher than other audiences. If the number is in red, that means it is lower than other audiences. We also have up and down arrows to show differences from over the years. Like Shelley said, this is our 7th year doing it. So we do some tracking from last year, from 2024. If there's a blue up arrow, that means it's higher than last year. If there is a red down arrow, that means it is lower than last year. Before we dive into the data, again, just a reminder, the focus will be on the nationally representative survey of patients. Those demographics you can see on the left of this slide. The Cancer Nation Connected profile is on the right. Like I said, this is the group who has raised their hand and engaged with the patient advocacy group. They are younger, they're more female, they're more educated, and they are higher income. Another key difference, they are more likely to have private insurance, either through their employer or a family member. That is the Cancer Nation Connected group. Our national patients are more likely to be on Medicare or Medicare Advantage. So something to keep in mind as we go through this report. I also want to note, like Shelley said, the full report will be available at the end. We do have an appendix full of profile slides for different subgroups and key audiences. All right, but let's dive in. So this first chapter of the study looks at the attitudes, the values, and behaviors across the patient journey, starting with diagnosis and decision-making around one's treatment. Since 2020, we have been tracking how prevalent a doctor knows best mentality is, and really it's been fascinating to see this over time. In 2020, 6 in 10 said that they relied on their doctor to decide on treatment decisions, and only 2 in 10 said that they were very involved. This became a bit more balanced during the pandemic, with more patients during that time reporting involvement in these treatment decisions. But the number who say they rely on their doctor has steadily climbed back to where it was 5 years ago. So this year we see 56% saying that they went with their doctor's decision, which is more than twice as many that say that they had an active involvement this year. And we have another 22% somewhere in the middle.
And I just want to add, because I've said this many times if you've heard me present, but it's important that that choice was to decide on the treatment because they did have the option of saying that it was somewhere in the middle. So this is why our national patient sample is so important because they represent the broader spectrum of who has cancer in this country and not just the people who are more engaged and connected to a group like Cancer Nation or other organizations. So I think I'm going to say the same thing I've said year after year is while we want to empower the patients who want to be empowered, we need to make sure the system works for everyone, even if they're not able or willing or interested in being empowered in decision making about their care and they want to just ask the doctor what to do, what they should do. Because when faced with a diagnosis like cancer, it's perfectly legitimate for them to just say, tell me what to do. And it can still be a shared decision if the right conversations are happening before that recommendation happens.
Great point, Shelley.
Thank you.
And to that point, we do see some interesting differences by audience. To what Shelley was saying, at that bottom row, the numbers in blue, no surprise, those who have engaged with Cancer Nation are more likely than others to be involved in their treatment decisions. So they're more likely to advocate for themselves, like Shelley was just talking about. This is also true of younger patients and Hispanic patients. That is a trend that we also see over the years. And same with parents of school-age children. They are also more active decision makers when it comes to their treatment. On the other hand, going up to the top row for relying on their doctor, stage 4 patients are more likely than others to rely on their doctor when it comes to treatment decisions. And the number of African-American patients who say that they relied on their doctor actually went up 7 points from last year. When we ask patients to rank what was important, what was most to least important when it came to making decisions about treatment, doctor's recommendations comes to the top and likelihood that the treatment will work. Those are significantly higher than anything else we asked on that list. Those are the top 2. We did add a new item to the list this year, which is why we're not seeing any differences from 2024. Once we add an item to a rank order, we can't really track differences, but we added insurance coverage for people to add. That is third on the list, with 25% saying that it was important when making treatment decisions. We're going to talk more about insurance challenges a little bit later, but keep in mind that a quarter factored in coverage when they were making their treatment decisions. Only about a quarter said that they sought a second opinion, mainly because they trusted their doctor to make the right decision for them. 82% said that they felt that way, and that's why they didn't get one. 2 in 10 said it was because they didn't want to delay their treatment. They really just wanted to get right to it, and they didn't want to hold off any longer. But the number of people who went for a second opinion doubles with an engaged group, like those that are connected to Cancer Nation, 53% saying that they got a second opinion. Patients who are younger, Hispanic, and parents are more likely to say they sought one as well, along with those that have private insurance. Something new this year, we were curious about this. We wanted to see if offering a telehealth option might motivate people to get a second opinion, since we just saw that only about a quarter do, and so few do. Only 18% said yes, that this would make them more likely to go get a second opinion. Again, they tend to be younger, Hispanic, and parents, so the audiences that are already more likely to go get a second opinion, having this option does encourage them a little bit more. But a majority, 63%, said that this would have no impact on their decision. However, outside of second opinions, most patients did seek out additional information to learn what they could about their disease. The most common resource at 36%, not surprisingly, were materials that their doctor gave to them. Almost as many, 31 and 29%, went to healthcare websites or Googled information on their own. And a little more than a quarter looked at information from cancer NGOs like Cancer Nation. Although few said that they turned to social media or videos for this kind of information, younger patients, those that are age 18 to 39, are more likely to turn to those resources.
And I just want to point out that 18%, so almost 1 in 5, said none of the above. Given all of these options for information, they say none of the above, which just shows the overwhelm that they feel when they're faced with the diagnosis. And sometimes it's too much information. And that, I think, goes along with the relying on their doctor to recommend a treatment choice.
Mm-hmm. And relying on their doctor to provide them information that they deem.
Right. And that's also that 18% there is fairly consistent over the last several years. It's always about in that range of almost 1 in 5 that say none of the above. They're not seeking additional information.
Mm-hmm. And so what this all boils down to really is trust. 95%, almost all of our patients trust their doctor as an information source for cancer treatment and care. 65% strongly feel that way, as we see at the top there. But far fewer believe that they can easily find trustworthy information on their own or be able to tell good medical advice from bad medical advice. And at the bottom, as we can see, very few trust what they see on social media when it comes to medical information. So as we saw on the previous slide, a third are doing their own research. It is hard for them to find trusted information on their own, and patients seem to think that doctors are their best sources. This year, we wanted to, take that idea of trust a little bit further and relate it to the more macro issues about cancer research. The good news is that almost 9 in 10 agree that cancer research and innovation benefits them, and this holds true across the party lines. At the same time, though, about half believe that this same research is influenced by politics. Again, very little difference there by party ID. So we see confidence in this research, but not necessarily in the systems that fund the research. And then speaking of research and our patients' participation in it, over the last 6 years, we've been doing this study, or 7 years, participation in clinical trials has hovered at about 1 in 10. This year is no different, at that 11%. Participation is higher, about 3 times higher actually, among younger patients. And we also see more participation among those of a higher socioeconomic status. While a doctor's recommendation is the #1 reason people participate in clinical trials at 51%, saying that's why they did it, almost as many say that they also participated because they wanted to contribute to science and help other patients. And then a third said that a trial was their best treatment option. Those are the top 3 reasons why a patient joins a clinical trial. Those who are currently in treatment are also more likely to participate because they think it could improve their level of care or get them access to new treatments, as well as maybe reduce costs or financial reimbursement. For clinical trial barriers, so reasons why people do not join a clinical trial or do not participate in a clinical trial, as we see in this study, as we've seen in other studies that we've done for other disease states, most people say that they haven't participated in a trial simply because they were not asked. 72% say they were not asked to join a trial, and that is why they did not do one. Only 5% say they didn't want to feel like a test subject or like a guinea pig. So while that's low, This is higher among younger patients and patients of color. That is a larger barrier for those audiences when it comes to joining clinical trials.
And so, Liana, I just want to, so when we see that in that top line, the younger patients, Black, Hispanic, and people in treatment are less likely to say they were not asked. So is the corollary they were more likely to be asked? Okay, I just wanted to make that clear. And also, the chronic people with chronic conditions also more likely not to be asked, which we know is a barrier to clinical trial enrollment. Is other chronic conditions that could be exclude them from trial participation.
Yeah. So let's transition to treatment and what people have to say about their cancer care experiences. Every year, we ask people how satisfied they are with their cancer care at each stage of their journey. So from screening through care to post-treatment care. Every year, a majority say they are very satisfied at each phase of the journey, typically with the exception of end-of-life planning and care. We are seeing that again this year, as you can see on the slide. But the key difference from this year to last year, this is the first year that the numbers have dropped across the board, anywhere from 6 points to 13 points, which is all statistically significantly lower than what we saw in 2024. So satisfaction is down across the board significantly. We were curious, why? How come? What's happening here? So we did a driver analysis to see what is driving this drop in satisfaction. And it's really two things, both of which we're going to cover over the course of this webinar and are important and alarming issues. But the first one is that there are more people who are struggling financially with their cancer care this year. There's more financial impacts and financial distress, and more patients are struggling with mental health issues this year. So those two reasons, those two challenges are leading to less satisfaction with cancer care overall. This drop also happened among the Cancer Nation connected patients, so they're also less satisfied than they were in 2024, and they typically give lower scores than national patients do. We saw that again this year as well. And then similar audiences that we've been talking about, women, Hispanic, and younger patients are also less satisfied. So where were patients treated? Over half of our national patients received treatment at a community hospital or a cancer center. 4 in 10 of Cancer Nation connected patients went to academic medical centers, which is significantly higher compared to our national patients. I will note that, calling back to the slide we just looked at, satisfaction scores across the cancer journey are directionally lower for patients that were treated at an academic medical center or teaching hospital, not significantly lower, but still lower than those that were treated elsewhere. Most did not have to go too far for their treatment, only with 61% traveling less than an hour one way. But unsurprisingly, those that are living in more rural areas, they are more likely to have to travel longer distances for their treatment.
I just want to point out, because we often get asked about differences we see in community-based treatment versus treatment in an academic center. So I think, first of all, I want to say that we take patient-reported treatment location with a grain of salt, because some people don't know these terms and they may misreport. One year, a few years ago, we asked them to select a location, but then also had them specify the exact location, and a board in turn had to go check, and a lot of people had it wrong in how they classified it, because what we think of in the advocacy community and in the cancer community is not the language that people use. We try to make the descriptions as easy to understand as possible. But I do think it's important that there was not that actually the people who were treated at academic centers had a directionally lower satisfaction, because I think the assumption is that people will be more satisfied at academic centers where, in theory, they might be getting better care or more coordinated care, and that's not what we've seen.
So from there, we drilled down on side effects that patients experienced. 93% of our patients surveyed said they experienced at least one side effect during their treatment, at least one. The most common physical side effects are fatigue, pain, loss of appetite, weight loss, sexual concerns, and nausea. But also common are mental health issues, mental health side effects. Those include fear of recurrence, anxiety, depression, and uncertainty about the status of one's cancer. Many of these symptoms are more pronounced for, again, women, Black, Hispanic, and younger patients. And this is a pattern that we continue to see over time when we ask this question. On this slide, we're looking at the most common side effects, so the top 10 that we just saw on the slide before. We ask patients a follow-up question for each side effect that they experienced. How helpful was their healthcare team in addressing that specific issue? The only place we see here where teams were deemed helpful was with nausea, vomiting, and diarrhea. But for everything else, less than half found their healthcare team to be very helpful in addressing that side effect. Cancer Nation connected patients were even less likely to find their healthcare teams to be helpful, showcasing why patients seek out an organization like Cancer Nation to help sort of fill in the gaps there. Now, despite those lower helpful ratings, patients' trust in their healthcare team remains high. We see this every year as well. 76% say they trusted their healthcare team to act in their best interests during treatment and care. But again, like we saw with satisfaction, for the first time since we've been asking this question, that number has gone down. That went down significantly, 8 points this year. Trust is also lower among women, younger, and Hispanic patients, but I do want to note that they are still high. They're just lower than other audiences, but 73% of women, 70% of younger, 67% of Hispanic, so 2/3. These are still high trust numbers. They just seem to be lower than last year. So even though we're seeing a decline, 3/4 is still very high, especially for complete trust in their healthcare team. And we couldn't field a survey without asking about AI. Everyone's talking about AI. We wanted to understand under what circumstances and what scenarios are people comfortable with healthcare providers using AI in their cancer treatment and their care. Bottom line, there's really no area where a majority are very comfortable. Majorities are at least somewhat comfortable with these more administrative tasks like scheduling appointments, collecting intake information. Those seem to be okay for some people, but few are comfortable with more clinical tasks like prescribing medications, assisting in diagnosis or assisting in procedures, recommending treatment plans. Those seem to be lower on the list. Younger patients are more comfortable with AI across the board, but again, still lower numbers for those more medical tasks. And Shelley, would you like to talk about why this is important?
So the reason we ask these questions, beside the fact that AI is everywhere, is I saw a study that asked patients to react to messages they received from their doctor in the portal as an answer to a question. And they liked the responses that were written by AI better than the ones written by their doctors, unless there was a disclaimer saying that it was written by AI. And it makes sense. Doctors are incredibly busy. They are trying to answer all the questions they get from their patients. And often they're just typing a quick response that just answers the question without adding kind of the niceties and the empathy that maybe an AI response would offer. But as soon as patients know AI is involved, they're less satisfied with that answer. The fact is that AI is already being incorporated into many aspects of care. I know I was at a conference last week where I heard a number of clinicians talking about how helpful it is to them to have the AI scribe in their face-to-face meeting with the patient so that they're talking directly to the patient instead of typing the whole time. And then that scribe helps them with their notes afterward. So there's definitely a lot of hope that this can actually improve the small amount of time that patients actually get to spend with their clinician. So my takeaway from this is that we need to educate. First of all, I don't think the answer is to not tell patients that it's being used. I don't think that's appropriate. I think we have to be transparent, but I think we have a lot of work to do to educate patients about why this is helpful to them. But also that means making sure that we are considering all of their concerns and that we are showing them how their privacy is being protected. And I don't know enough about how the privacy is being protected. So I think that that's something we need to understand and be able to communicate to patients so that they can get more comfortable with it. But the answer is not to not tell them, it's to be transparent, but also educate them on how this can help them.
And knowing their comfort level going into those kinds of conversations.
Right. Yes.
This year, we wanted to better understand if and how other health conditions impact people's cancer treatment and vice versa, if their cancer treatment impacted their other health conditions. So given the average age of cancer patients, I believe it's 67. In our survey, our average age was 62. It's not a surprise that 8 and 10 have another disease diagnosis. The most common in our survey are high blood pressure and high cholesterol, with 4 and 10 saying that they have a diagnosis of those. Most said that they were diagnosed before they learned that they had cancer. So most of our patients with another condition received that diagnosis before being diagnosed with cancer. We were happy to see that while 8 and 10 patients said they were more focused on their cancer treatment than other health conditions, in most cases, people said that their cancer treatment did not impact their ability to manage those comorbidities. So there is one key exception though, and that is mental health. Half of those who had some kind of mental health condition prior to their cancer diagnosis said that it became harder then to manage that diagnosis while they had cancer. In addition, most of our patients, 85%, felt that their healthcare provider who handled their other conditions did a good job coordinating care with their cancer providers. This is slightly lower than when we asked about healthcare providers generally, but still good numbers across the board here. All right, so let's talk about emotional health and support, because as we're seeing in this data, this is a major challenge and a concern and issue for cancer patients. We already noted earlier in the webinar that 1 in 3 cancer patients struggle with anxiety and depression. So we wanted to dig into their support systems. Almost everyone we surveyed said they felt at least somewhat supported during their cancer treatment. 6 in 10 said they felt very supported. But at the same time, majorities tell us that they didn't feel like themselves, or they felt pressure to remain strong and didn't feel like their network, their friends, or their family truly understood what they were going through. All of these numbers are higher for those who are currently going through treatment really in the thick of it, unlike those who have completed treatment, which is a pattern that we do see every year. Those who have completed treatment tend to give higher scores or say they had better experiences than those that are being treated today. For these statements that detail emotional struggles, emotional issues, those numbers are also higher for women, younger patients, patients of color, and they are especially high for those that were caring for children during their treatment for parents. And when we drill down into specific types of support, less than half feel very supported with simple things that can become difficult when you have cancer. Things like staying focused, staying calm, feeling understood. The fewest at the bottom there, the fewest feel supported though when it comes to coping with loneliness. This is especially true for stage 3 and stage 4 patients, so later stage, women, and those with a lower socioeconomic status. So how are people coping? 6 and 10 say that they are talking to their friends and their family. 4 and 10 are taking medication, but only 2 in 10 are speaking with a mental health professional. And even less, only 9% sought out support groups. So patients are talking with their friends and family, which is great, but not trained professionals or other patients who might understand what they're going through a little bit better. The good news, though, if we look at the green bar on the right there, younger patients are more likely to be doing many of these activities. So maybe the tides will turn and we'll see an uptick in these activities as we continue to ask this question over the next few years. Among those who worked during their cancer treatment, and that was about half of our patients, most felt that their jobs were supportive both before and after treatment. I will say though, this is slightly lower for parents and for women. They were less likely to feel very supported by their employers. The most common types of support that they received from their employers were flexible hours and paid medical leave, 4 in 10 saying that these were offered to them. A quarter said they were able to work remotely during their treatment, and 2 in 10 said that their job responsibilities were adjusted for them. And to the right there, we have some direct quotes from patients detailing why they felt supported, what their employers did to make them feel that way. They say, my employer continues to be understanding of my need to adjust my schedule for my appointments. They are always checking on me, and they let me work at my own pace. But on the flip side, to the right, we have some quotes from people that say that their employers were not supportive. They were demoted, then terminated, told to reapply when I'm back to 100%. They never asked how I was doing. They just expected me to be able to do my job as I did before, and they were much less willing to work with me. They did not want to adjust my hours or my responsibilities as I worked through my recovery. All right, let's transition now for life after treatment and survivorships and post-treatment care. 7 in 10 patients who were treated within the last 5 years are currently seeing a healthcare provider for their post-treatment care, but that number drops to 34% once you cross the 5-year mark. In most cases, this is because the doctor said that there is just no longer a need for medical care at this time. 58% say that is the reason why they are not under post-treatment care. Most of those in post-treatment care are still seeing their oncologist. 62% say that they are seeing their oncologist. This number has gone up steadily over the last 4 years. As we can see, a third in 2022 said that they were seeing their oncologist. Now we're up to 2/3. And we're seeing the opposite happen for the number who say that their primary care provider, their PCP, is managing their post-treatment care. That has been declining. We were at 4 in 10 in 2022, now down to 17%. We do see some reluctance, definitely, to seeing a primary care provider for post-treatment care. Just a third of those who are not seeing a PCP today would be willing to do so for their post-treatment care. Patients are concerned that their PCP lacks the experience that an oncologist has, particularly when it comes to spotting symptoms of a recurrence. I think that first quote there on the right really sums it up very well. They say primary care physicians do not have the experience of oncologists, so I'm not confident that a recurrence would be caught early enough for the treatment to be effective.
So I'm just going to jump in here and say that we have definitely noticed, of course, the decline in people willing to see, or the increase in people seeing their oncologist for post-treatment care, and the reluctance to see a primary care clinician. And I'm happy to say that we are planning to do a parallel study with oncologists and primary care clinicians to really understand more about this dynamic. We hear anecdotally from primary care clinicians that they're happy to treat cancer patients. They just need to know, what do I need to know about their cancer treatment to be able to effectively manage their care? We also hear anecdotally that they say, I don't have time. I can't learn all the things I need to learn about this person's cancer history, so I can't manage that care. So it's all anecdotal, and we wanted to have some more data on it, and which is why we're going to do this study, and we will be sharing those results in the spring. Also, there is an emerging trend of onco primary clinicians who are really focused on taking care of cancer patients and cancer survivors for their primary care, sometimes integrated with their oncology care. I think that's a wonderful model. It's not something everyone has access to, though. So we're going to be looking at, what do we hear from the clinicians, and what does that mean for our advocacy efforts? So that's something we're going to be working on later this year and into next year. So we're very excited about that, and stay tuned for more from us on that.
Now, even after years of advocacy, just a third of patients report receiving a survivorship care plan. 36% of national patients say they received one. That's lower than what we saw in 2024, with 43% saying they received one last year. 29% of Cancer Nation connected patients say that they received one as well. However, those that do receive one, when they do get them, large majorities find these plans to be helpful. We see 97%, 90%, and even for that top box score, that very helpful, 2/3 of national patients say that the plan they got was very helpful. So when people are getting them, they're working. And majorities of those that are currently in treatment are very interested in receiving a plan for when they finish treatment. 85% say that they would like to receive one. And interest is significantly higher among younger audiences or younger patients. This is particularly important given the lack of confidence that most patients have about most areas of their post-treatment care. Follow-up tests and screenings, that's where people sort of 6 and 10 feel very confident when they know what to do when it comes to their follow-up tests and their follow-up screenings. But beyond those two items, less than half are very confident. They know how to manage their health or where to go for support, know what the best diet is, and so on. But those with plans, those with survivorship care plans, as we see on the right, are significantly more prepared and more confident for post-treatment.
Okay, so this is where I get to get on my soapbox. So we hear a lot of pushback sometimes from healthcare professionals that survivorship care plans are not helpful. They're not solving all the problems. They're not a panacea, and we agree that they're not a panacea. But we're not willing to back down on the need for survivorship care plans because we know, and we knew before we had this data, but we wanted to quantify it here, that people are ending treatment not feeling confident about what they need to do next. And as Liana said, the only two where more than half said they were very confident is on follow-up tests. Follow-up tests and screenings are not sufficient for survivorship care. That is the bare minimum. But it's when we hear from people all the time that the first year after treatment is harder than treatment itself, it's because they're trying to figure out how to manage their lives now that they don't have access to this care team that was helping them through their treatment. And they don't have the confidence to manage all these things on their own. Those who have a plan are more confident. So we need to figure this out. We need to figure out how to make sure that patients get survivorship care plans. It's not okay that only a little over a third are getting them. And we need to make sure that the design of the survivorship care plan is helpful to the patient and to whomever that they're going to be sharing their care with. So if the plan needs to be a tool to share with the primary care clinician about what they need to know about the patient's care, then that's part of our survey of primary care clinicians will help us to make recommendations about what should be on that survivorship care plan to make it useful for the primary care clinician. And also, we know what patients need to know. We've asked before about what they need, what information they need. But this was a new question to ask about their confidence levels this year. And I was not surprised that their confidence levels are low. And to me, this just argues for why we need to figure this out. And we are going to continue working with clinicians and anyone who will work with us to try to make sure that it becomes standard of care for cancer patients when they're completing treatment.
Well, I love when Shelley gets on her soapbox. Always
Thank you.
incredible.
Thank
So
you.
that gets us to the last chapter of our webinar, which are financial challenge and insurance issues, which I talked about a little bit throughout, but we're really going to dive deep here. There are many issues that cancer patients grapple with. I feel like I'm preaching to the choir here. Everyone here knows this. Physical, emotional, lifestyle challenges. But I really want to focus on the middle column here, the financial and the insurance piece. So 73% say that they are worried about the rising cost of health insurance. And this survey was fielded before open enrollment. So 7 and 10 were already concerned before premiums went up. Concerns about all the other items on this list also went up this year. We last asked it in 2022, so they're looking at the difference between the last over 3 years. Cost of care, cost of prescriptions, and expenses for non-medical items and needs. Those are all concerns that are higher than they were in 2022. What is truly alarming is the number of people who report some type of financial distress this year. That has gone up 12 points to 52%, saying that they were financially impacted as a result of their cancer. This is significantly higher for younger patients, patients of color, stage 4 patients, and parents, so they are more likely to say that they had a financial impact. But interestingly, the group that is least likely to have any type of financial challenge are those who have either Medicare or Medicare Advantage. 43% say they were impacted financially. So still a good chunk of that audience, 4 and 10, but that is significantly lower than the others, anyone that has a different type of insurance. In terms of what struggles people have, they really range from having to spend their savings to needing government assistance to delaying major purchases like buying a home. All of these are items that we saw increases for this year. A third also report insurance challenges higher for those that are currently in treatment today. There wasn't one specific challenge dealt with by a majority, but as we can see there at the numbers in blue, we see those in treatment are more likely to have to fight to get the treatment that they need, whether that's them fighting the insurance company or their doctor fighting the insurance company. And these challenges are even more acute for those with private insurance versus those with public insurance or Medicaid, especially Medicare or Medicare Advantage. Only a quarter of patients with that insurance reported having insurance issues. Now, looking at out-of-pocket costs, a third say that they spent more than $1,000 for their medical care in the last year out of pocket. Again, higher for those with private insurance. And we see those same audiences that we've been talking about pop here, stage 4, younger, Hispanic, and parents. They are all more likely to have to spend $1,000 or more, or they're more likely to have spent $1,000 or more in the last year. And then, Shelley, do you want to speak to that 72% we're seeing on the right?
Yes, one of the changes to Medicare Part D that went into effect this year is that there's a $2,000 cap on out-of-pocket costs that patients have to pay for their covered Part D drugs. And we just asked about awareness of this, and 72% of those on Medicare were aware of this cap. And then if we go to the next slide, we also asked questions about the Medicare prescription payment plan, which allows them to spread their costs over the year. So about half were aware of the plan, and only about a quarter are enrolled. And we asked if you did not enroll, why? For about a little over a third, it's because their annual drug costs are low. So if someone doesn't have huge costs, it may not be worth it to them to spread the costs out over the year, particularly with the $2,000 cap. But there's still 20% who did not know about the plan. And then others who don't want to change how they pay for prescriptions or their drug costs are the same each month. I think the reason we asked this is because this was an important benefit that was added through the IRA, Inflation Reduction Act. And the concern was that not a lot of people knew about it. And I think that is true. Not everybody, that the awareness is low, but also even of those who are aware, there are other reasons why people might not choose to enroll in this plan. So we're just going to go through a few of the key takeaways. So trust in care versus satisfaction. Most survivors continue to trust their doctors, even while their satisfaction while high, is declining across every stage of the cancer journey. I do also want to point out that we've seen every year that the satisfaction with the post-treatment care is always 10 or more points lower than satisfaction with the treatment. So people feel grateful to the care team who helped them through their treatment, less satisfied with the care that they receive after. While we know that 9 in 10 patients experience side effects, but few feel that their teams were very helpful in managing them. This is consistent with what we've seen before. And these side effects really do have a big impact on how they live their lives during and after treatment. So we really focus on whole person care, and that means we really have to look at all of those side effects and making sure that patients are getting the support they need. We've seen depression and anxiety very high every year, and particularly high for young adults diagnosed with cancer. And this year, we also heard about loneliness and how important that is, how many people are dealing with that while they go through treatment. They do turn to family and friends for support, but they're not getting meaningful mental health support from their care teams. And it really leaves them anxious, isolated, and exhausted. Survivors overwhelmingly believe that cancer research benefits them, but they also, more than half, believe research is influenced by politics. Next slide. Financial toxicity, about half of all survivors report at least one hardship. And as Liana noted, that is much lower for the Medicare and Medicare Advantage and extremely high for the young adults. Medicare and Medicare Advantage is good insurance. Even though there are challenges with Medicare Advantage and prior authorization, it's still a good insurance plan for people when they're going through cancer treatment compared with people who have other sources of insurance. So those folks are a little bit more insulated from some of the financial toxicities that others experience. And then the rising cost of health insurance is a huge concern for people. Also with insurance, when a quarter of people say that one of the top two factors in their treatment decision is insurance, then that's a problem. Insurance should not be the driver of your treatment. It should support the treatment that you and your doctor think is most important or is the best choice for you. And then 1 in 3 patients said that they had at least one insurance issue during treatment, most often denials, delays, or excessive out-of-pocket costs. And then finally, with survivorship care plans, only 1 in 3 report receiving one, down from 43% last year. Survivors don't feel prepared in managing most aspects of their care post-treatment, but those who get a survivorship care plan are significantly more confident in managing all of these side effects. So that it remains a clear, actionable path to helping people improve their post-treatment quality of life. And that is why we are going to continue advocating for the use and the payment for survivorship care plans. And before we go to Q&A, I wanted to mention 2 things. One is we're going to post the results on our website so that you can download it. The slide deck, there were a few slides that we did not cover just because we wanted to make sure we left a little time for questions. So there's a little bit more data in there. We also share the data sets with researchers who are interested in using it to help with their research. And there's a form on our website that you can fill out to request the data. I love when I go to a conference and I see a slide that uses our data. That makes me very happy. So please do ask for the data set if you could use it in your research. And I thank the EDGE team and the Cancer Nation team, but I also forgot to mention Jackie Hook, our designer, who helped us turn this into beautiful slides. And I would say the team at Mighty Good that we worked with as we transitioned from National Coalition to for Cancer Survivorship to Cancer Nation, helping us design the look and feel. It was really fun and exciting to see that put into use in this slide deck, which has a ton of data, and we love the colors and the look and feel. So I'm just grateful to everybody who helped make this happen. So now we can go to Q&A, and I did see one question about AI that I wanted to mention. And I want to clarify, I'm not saying patients need to be comfortable with this. I'm saying it's happening. And if it's going to happen, we need to, first of all, make sure patients are protected, and then make sure that we're transparent with them about how it's being used, and educate them, because there are some potential benefits, even though there are concerns that patients have. And I think it needs to be in the open. And my fear is it's going to happen and they're not going to know, and they're not going to have that comfort level for how it's being used. So I think we need to both make sure AI is being used appropriately and make sure that we're educating patients about how it's being used. So let me look at the questions. I don't know, Liana, if you've seen one that you want to tackle while I look through them.
I'm looking at them now. Thank you all so much for being active attendees, active participants. It's always fun to see this. We did not ask about cancer vaccines this year. Shelley, I'm not sure if we asked anything like that in previous years that we could maybe turn to and get that answer. We'll take a look at that, see if we've had that before.
There's a question about survivorship care plans becoming a requirement at care centers. They actually were required, and that requirement was removed. And so that is a concern that we have, that it is no longer required. But one of the things that we have long advocated for and will continue to is payment for cancer care planning, because we know one of the reasons clinicians don't do it is it takes time to create the plan based on data coming from various different sources. If it were easier to do, I think we would have less pushback, but it's not always easy because there's a lot of data. So perhaps this is something that AI can help with. And I'm sure that there are people who are working on that, but we know that there is a lot of work behind the scenes that goes into creating the plan. And clinicians are only reimbursed for that face-to-face time when they're presenting the plan. And that's why we've advocated for a long time for payment for this. We anticipate that the bills that we have worked on that would create a Medicare payment stream for care planning will be reintroduced this year.
I do see a couple questions just asking if we do break down the data by type of cancer. We do have that. We do have that data available. We don't have it really called out in the report, but if there are any specific questions, if there are any specific types of cancer that you would like us to look at, we could certainly dig into that and report back to Cancer Nation.
I know there were some questions about utilization of support groups. I think one of the things every year we learn things and then it inspires new questions for the next year. So I am interested to know why so few are using support groups. Is it because they're not interested, or is it because they don't know how to access them and they're not available to them? And I think I'm sure it's a combination, and I'm sure that it depends on the group. And that the demographics are probably, certain groups might be more interested or less interested in support groups. So I think that's something we can dive into next year and ask a little bit more about why they're not using those and whether it has to do with access or interest or both.
Yeah, I thought it was interesting that patients felt like their friends and family didn't really know what they were going through, but then 6 and 10 said that that's who they're talking to, that's who they're sort of getting help from. So agreed with you there, Shelley.
I think also the feeling that people don't understand what they're going through sometimes even heightens in post-treatment care because I think, everybody knows when you're going through treatment that it's a challenging time, but I think there's still lack of understanding on the part of family, friends, and employers that it's not over just because you finished treatment and that you're going through a lot of physical and emotional challenges. And I know I've heard people say, that their family is like, well, you're done. What's the big deal? Because they don't understand how much of a change, how much of their cancer impacts their whole life going forward. So what are we going to work on in the next year based on the survey? We are advocating for the use of survivorship care plans and for whole person cancer care. And financial protections. Those are kind of our three big focus areas, and we do that through legislation, working with members of Congress to introduce legislation. And this Congress is a very difficult time to get anything done, but we're not giving up. We're still going to work with them to get these bills introduced so that we can try to address some of these issues. We will have our advocacy day next year, next June, where advocates will go to the Hill and talk about legislation. This year we talked about we talked about the Medicaid cuts in the One Big Beautiful Bill and advocated against that because that's going to hurt cancer survivors who will lose coverage. And we also talked about research funding. What we're talking about next year will depend a little bit on where we are with different health policy issues going on, but I'm sure it will include advocating for payment for survivorship care plans and for other supportive care that patients need to have that whole person care. I see a comment that men are less likely to join support groups than women, and that's what I was thinking about. I didn't want to make that assertion without asking the data, but I think, or asking in the survey, but I do think asking what would be helpful would be really important because I think that is absolutely right that sometimes it's harder for men to get the support because they're not as comfortable with a support group. And then there's great organizations out there that focus on men with cancer and helping provide that support network for them, but not everybody knows about it to get connected with them.
I saw a question about integrative oncology, which we did not ask about in 2025, but we have asked about that in previous years. So I can jot down your name or your information. You can put in your email if you'd like, just to me, and then get you some data points on that from previous years.
You could also download the survey reports from previous years on our website as well. And we did ask about integrative oncology last year and the previous year, so 2023 and 2024. Unfortunately, they make me delete questions every year because we have too many. It's a long survey. I know I heard from some of you probably participated. I heard from some of you that it's very long. I'm always asking, can we ask this? Can we ask this? And Liana and the team are saying, well, what are you going to take out? So there are questions that we'll only ask every 2 or 3 years so that we have room for the new things that I want to ask.
When asked about, do patients feel an oncologist or a PCP is able to provide survivorship care? We saw some reluctance in the data for PCPs managing post-treatment care. Only about a third are willing, who are not currently seeing a PCP today, are willing to do so for their post-treatment.
I see some resources being posted in the chat too. So as far as the after cancer and providing support groups, and I know that there's other Cancer Hope Network also provides support, and there's lots of other groups, Cancer Support Community, that provide that mental health support. There's a question about questions on active smoking and openness to cessation. So that's a great point, and we can consider that for next year. If you have other ideas for questions we should consider next year, please let us know. Again, we always we get more questions, or every time we get more information, it just adds to the questions that we want to ask the following year. Oh, okay. So there's a question about by cancer type. We don't usually have statistical significance by very many cancer types because with 1,300 in the national sample, what are the top ones, Liana? It's, breast
Cancer,
colon.
prostate cancer, and skin cancer. And we do have enough as well in cervical and colorectal to look at those. So if there are any specific questions about those, we are happy to look into that and report back.
And that's where if you go and submit the request on our website to download the data, then you can do some of that analysis. And even even if we may not have in one year, if you kind of look at across years, you get a larger sample of those of different types of cancer. So we have people with all cancers in the survey. We just don't have statistical significance to be able to say how someone with esophageal cancer might be different from someone with bladder cancer or prostate cancer.
Yep. Looks like about 1% for 6% bladder cancer. So yeah, just not enough to look at with confidence.
Thank you so much for all the discussion in the chat. There's really great comments. I think that we will conclude there. You will get an email with a link to all of the information on our website where you can download the report. Definitely let us know if you have ideas for questions we should ask next year. Thank you again to our sponsors, to the EDGE team, the Cancer Nation team, and to all of you for joining us today. We look forward to working with you on taking action on this data to try to make cancer care better for everyone touched by cancer. Thank you. Have a great day.